Hi friends, ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ನಿಮ್ಮ ಸಂದೀಪ್. Once again a warm welcome to Sunshine Nursing Skill Studios. I'm really happy that many of you are liking my channel and subscribing my channel. Hope my videos will be very informative for you in the field of nursing. Yes, today I am here to discuss about pathology. In the last video which I have made regarding to the pathology, it was about introduction, a brief introduction about the pathology. But today I'm here with a topic, very interesting topic, and also it will be very informative for you all, which is related to some of the entities which is related to the respiratory disorders. It might be like a tumors, inflammations, or maybe some obstructive diseases. So these are the some of the topics which we are going to discuss. But in this video I am just going to brief you, that is give a brief introduction about these respiratory disorders that is under pathology. So come, let's start the session. We are going to discuss about some common entities of respiratory disorders like obstructive, restrictive, infection, inflammatory disease, immunological, tumors of the lungs, etc. To start with the pathology of respiratory system, let us first understand what is respiratory system. Respiratory system is the network of organs and tissues that helps you breathe, which includes lungs and blood vessels. Some of the functions include gas exchange, breathing, sound production. The image displayed in front of you shows the organs of respiratory system, X-ray view of a lungs, and the normal anatomical view of a human body. The components of respiratory system includes the upper respiratory system and the lower respiratory system, which we have already studied in the anatomy and physiology in the first year. Here is the microscopic structure of a normal lung. In continuation with this microscopic structure, we also going to know about some gas exchanges, that is alveolar gas exchange. The picture right in front of you explains about alveolar gas exchange. Now, how to check whether our lungs are functioning properly or not? There is a way, that is using this method called pulmonary function test. To understand pneumonia, it is the inflammation of alveoli caused due to bacterial, viral or fungal. It is classified into types called lobar, broncho and interstitial. Symptoms include fever, cough and dyspnea. The image displayed here shows the X-ray image and the real lung image of lobar pneumonia primary and bronchopneumonia which is secondary, and these are the classification under broncho, that is difference between broncho and lobar pneumonia. To brief about tuberculosis, it is considered as potentially serious bacterial infection of the lung caused by Mycobacterium tuberculosis with symptoms of fever, cough, weight loss and night sweat. Chronic obstructive pulmonary disease comprises a number of different respiratory diseases with pathological obstructions of pulmonary airflow as common pathogenetic mechanism. And here we see it is classified into localized and diffuse. To understand the clinical pathology of the asthma, it is a chronic hypersensitivity inflammatory disease of bronchi which leads to excess mucus and spasmodic occlusion caused by allergic and non-allergic, that is allergic which is related to the infection, non-allergic due to neurogenic and psychogenic. Symptoms include dyspnea, wheezing, coughing, tachycardia and chest pain. Some of the commonest cause for COPD includes smoking or pollution. Now let us understand the pathogenesis of smoking. The image here shows the difference between the normal and healthy lung versus the smoker's lung. The COPD also include some of the diseases like bronchitis, which is being showed here, the bronchitis lungs, and also we are going to see the pure chronic bronchitis and pure emphysema. So image represent here the difference between the bronchitis and the pure emphysema. Some general information about emphysema includes patient's body posture with symptoms including breathlessness, cough, fatigue, and weight loss. And now to know about some of the complications under COPD includes heart failure, acute respiratory distress syndrome, frailty that is weakness, depression and pneumonia. Bronchiectasis is a condition where we can see the permanent dilation of bronchi with pus with symptoms of cough and sputum with the pus, and it is commonly seen in lower lobe. Now let's move on to understand lung tumors. It is an abnormal rate of cell division or a cell death in a lung tissue. Lung cancer, it is one of the most common and fatal cancer. It kills more people than the people suffering with the breast and prostate cancer. It is seen in developing countries and most common cause for this is smoking. So here is some of the incidence rate which is seen all over the globe. Some of the classification of lung tumors includes benign tumors which is very rare, malignant which is common, and tumors of pleura. The slide tells about clinical classifications include small cell cancer, non-small cell cancer, also about the clinical features and complications. To understand the stages of cancer, but before doing that, let us understand the terms called TNM. The T stands for tumor, N stands for node, and M stands for metastasis. And the stages include stage 1, stage 2, stage 3 and stage 4.